I think it's time for us to officially open the CEP webinar on the topic, the European Mental Health Curriculum for Probation Officers. My name is Jana Špero-Kamenjarin. I'm Secretary General of Confederation of European Probation, and it's my honor and pleasure to be opening today's webinar. For Confederation of European Probation, the topic of mental health is of great importance, and I'm very happy to share today this webinar event with my colleagues from the CEP and with our expert group on the mental health. And now going back to mental health curriculum, as every curriculum, it has different modules, and this is not a spoiler alert, just to tell you that different modules will be presented by different members of the expert group. So we hope this will add to the dynamics of our talk. And in the end, you will hear more about the pilot that is also connected with this, but to learn more, stay with us until the end. And now I'm giving the floor to our dear colleague, Cristina Neves from Portugal, who is a chair of the expert group for CEP, who was the leader for this amazing group of people, to start with the introduction of mental health. Cristina, the floor is yours. Thank you so much.
Thank you. Thank you so much, Jana, and all CEP team. Hello, everyone who joined us, and thank you also for being here. So as Jana said, I am Cristina Neves. I work in the DGRSP, which is the Portuguese Probation and Prison Service, and it's my pleasure to introduce you to the curriculum today. Let's start with the big question, which is why a European mental health training curriculum. We based our work a lot on the previous research, and previous research tells us and shows us that there is a high prevalence of mental health needs within probationers. It also shows that probation officers have levels of mental health literacy that are variable across countries and across jurisdictions. So the conclusion that it wasn't taken by the group, but was already concluded by previous research, was that having a harmonized training framework could improve the staff capacity to manage mental health more effectively, also support the well-being of probation officers, enhance the quality of supervision, and of course, ultimately, what we all want, contribute to a better rehabilitation outcome and reducing reoffending. So with this concern, we had a very dedicated group of experts and colleagues who you will meet in a moment that set out to develop this curriculum. The work was very inspired by the previous research of Charlie Brooker. And the group was also lucky to count with the external consultancy, namely of Gargana Manolova, who you will also meet today. Moving forward, how did we develop the curriculum? So we started by a comprehensive literature review, and also based on our own experience as professionals. We tried to align with the European frameworks, including the Council of Europe standards and recommendations. We also did a comparative analysis of training programs across several countries, and we tried to integrate the recognized practices of other services. This work was collaborative in the sense that it was based on ongoing discussions within the CEP expert group, and as I also told you, it also counted with external consultants. We can move on. The collaboration at a certain point extended to the stakeholders. So we decided at a certain point, after having a first draft of the curriculum, that it was important to show this first draft to several probation officers, experts, who could give us feedback on what they thought about the curriculum, if it was appropriate or if there were any changes they would suggest. So we did a peer review of the curriculum by experts and practitioners that in total included 14 European jurisdictions. And we would like to thank everyone who participated in this review. Maybe some of you are with us today, I don't know. However, it is important to state that this was very precious for us. So 32 reviewers gave us important feedback that we considered for the final version of the curriculum. And I also want to say that we also included feedback from 4 service users with lived experience who also gave us a feedback that showed that we were on the right track. To give you an overview of the curriculum before it is presented in more detail by each one of the members of the expert group, and I think we can move a slide forward, please. The objectives of this curriculum are, as you can see on the screen. So we would like to build a training curriculum with the purpose of providing foundational knowledge to probation staff about mental health issues. We would like that this curriculum or the training that is done based on this curriculum will enable probation staff to be more aware about the presentations of mental health issues and be able to interact more effectively with probationers with mental health issues. Also develop competency in referring adult probationers to mental health services and raise awareness about their own self-care and their own well-being. So this curriculum can be used with probation officers on initial training or with already current practice, working on general adult probation or mental health settings. And so no specific training background is required. It's quite inclusive, the training curriculum. Moving forward, this is how the modules of the training curriculum look like. So we have a modular structure with 9 modules. For each module, we have a suggested duration. This duration should be considered the minimum standard. So each service can decide to use more hours for each module. If all modules are to be implemented and using the minimum duration, the minimum length of the training curriculum will be 24 hours, so more or less 3.5 days. The module structure allows it to be used in full or just individual modules. I'm almost finishing the introduction, but it's important before finishing to make it clear that this mental health training curriculum provides an outline and a syllabus for each topic. So it doesn't include the specific contents, which should be developed by each service and jurisdiction. Also, the trainers should be selected by each service or jurisdiction. So this is important to mention. So just to give you a brief idea on how it looks, each module, the next slide will show you, in case you haven't seen, you haven't had the chance to go through the document, the curriculum. So for each topic, this is what we suggest. So it is a syllabus, not the specific contents. So now each of the members of the expert group will present each module in more detail, the syllabus of each module in more detail. And so I give the floor to Owen Ryan. Thank you.
Thanks for that, Christina. Hi, everybody. My name is Owen Ryan, and I'm a regional manager in the probation service in Ireland. Okay, the first module in the curriculum is a foundations module. And again, I suppose the reason why we felt it was very important to include a foundations module is so that we don't assume where everybody is at in terms of their knowledge or experience of working with people with mental health issues. So as Christina's pointed out, there's a far greater prevalence of mental health issues amongst people on probation supervision compared to the general population. and the mental health literacy scale studies indicate that there's a huge variation amongst probation officers in their recognition, understanding, and confidence in working with service users with mental health presentations. For instance, probation officers are far more confident in working with people with substance misuse issues as opposed to mental health issues. So this module sets a baseline of understanding for the mental health curriculum. Okay, so the learning outcomes of this module are to basically kind of set agreed definitions. So define what we mean by mental health and the most common types of disorders. Identify the factors that impact on mental health and mental well-being. Understand the link between offending and specific mental health disorders, and also dispel the myths and stereotypes about mental health issues. Okay, and then the key content in this module then, we have an overview of disorders such as psychosis, affective disorders, anxiety, depression, personality disorders, dual diagnosis, etc. We also think it's important that there's a piece on the discussion around mild to moderate presentations versus severe and enduring presentations, looking at mental health issues and criminal behaviour, and there's a question of, is it a matter of risk or responsivity? And then we look at exacerbating factors, how that impacts on the individual, such as substance misuse, unstable family, and unstable accommodation. And also in the foundation module, we include a piece on international research, such as the mental health literacy scale studies. So that is the first module, and I'm now going to hand over to Michael McCracken from the Parole Board of Northern Ireland, who's going to talk you through the module on adverse childhood experiences and trauma.
Thank you very much, Owen, and good afternoon, everyone. It's lovely to see so many of you online for the launch of this important curriculum. I am Michael, and I am the Chief Psychologist for the Probation Board in Northern Ireland. As Owen has said, I'm going to talk to you a little bit about the module on adverse childhood experiences and trauma. Trauma exposure is common throughout the world. The World Health Organization's mental health survey gathered data from almost 70,000 people across 24 countries and concluded that 70% of respondents experience lifetime traumas. We also know that there is an even higher prevalence of adverse childhood experiences and trauma with those who are involved with the criminal justice system. 85% of justice involved males and 94% of justice involved females in the United Kingdom have experienced at least one adverse childhood experiences. While children in care account for less than 1% of the general population, they make up about a quarter of the adult prison population. And about 70% of our female service users and around 40% of our male service users have witnessed or experienced domestic violence in the home when compared to roughly 11% of the general public. And our service users are also more likely to have experienced multiple adverse childhood experiences. And we know where 4 or more adverse childhood experiences coalesce together, it has significant life course impact. Individuals with multiple ACEs face higher risks to physical health and mental health disorders and health harming behaviors. Now, also, the impact of trauma and adversity can show up, in our service users as defiance or hostility, aggression, and potentially as mistrust of authority. And we ourselves work in a critical profession, one where there is a risk of psychological impact on us due to the challenging nature of the work that we do. So the learning outcomes for this module are therefore including recognizing the signs and symptoms of trauma in service users, as well as recognizing signs and symptoms of vicarious and secondary trauma in workforces. Understanding the need to resist re-traumatizing people and exploring appropriate responses to people who may have experienced trauma. The key content will cover sentinel markers for trauma, the sorts of key events that are more likely to lead to trauma, exploring what trauma is. It's not what happens to you, but what happens inside of you as a result of what's happened to you. And in English, at least, we talk about the 4 R's of trauma, which is realizing that trauma is widespread, recognizing the signs and symptoms, responding by integrating knowledge about trauma into our daily actions, and resisting re-traumatization with our service users. I trust that you find the curriculum outline for this module helpful. Thank you once again very much for your support of the CEP mental health curriculum, and I will pass you on now to our colleague Yvonne, who will talk to you about the module of working with psychosis. Thank you.
Thank you, Michael. So, welcome everybody. My name is Yvonne Murik. I'm from Germany, from the federal state Baden-Württemberg, because in Germany the probation service is organized by each federal state. So I like to add that I'm from Baden-Württemberg. I will show you our work about the model working with psychosis. Like Ian and Michael, I like to start by explaining why we think it's important to provide this model. And according to us, there are 2 main reasons. First, probation officers frequently encounter individuals experiencing psychosis, and second, knowing how to engage with affected probationers is crucial for risk assessment, crisis management, and supporting rehabilitation efforts. For this model, we suggested a duration of 3 hours, and we recommend that the trainers are mental health professionals with experiences in this field and or experiences probation officers in mental health, to name just a few ideas of trainers. Then we can move on to the learning outcomes. On this slide, you can see the learning outcomes of the model working with psychosis. It's important that by the end of the model, the probation officers should understand the definition and characteristics of psychosis, including its causes and symptoms. The probation officers should develop an awareness of common psychotic disorders, such as schizophrenia, schizoaffective disorder, and drug-induced psychosis, to name just a few of them. A third learning outcome is to develop skills to effectively communicate with probationers experiencing psychotic symptoms. And according to us, it's also important that they understand the evidence-based treatment approaches, including medication, therapy, and social support. And the last learning output, well, the last bullet point of the learning outcomes, is when and how to refer individuals with psychosis to special mental health services. Then we can move on. To achieve the learning outcomes that shown before, the model includes the 5 main issues, and for each of the main issues I will mention only a few subtopics because of time, and you can find additional details in the curriculum that's really detailed. So first we will give in this model an introduction to psychosis with a definition and characteristics that includes the biological, psychological, and social conditions of psychosis. Then we have a closer look on different types of psychotic disorders, as I mentioned before, for example, schizophrenia, schizoaffective disorder, or drug-induced psychosis. Then it's important to us, or an important issue, how to engage with probationers with psychosis. For example, we will learn in this content area effective communication techniques for individuals who have delusions, as well as de-escalation strategies for probationers in acute distress. Then it's also an important issue, the content of treatment and management of psychosis. That includes, for example, the role of the probation officers in supporting treatment compliance. And the last content with the legal consideration includes the question when and how to refer to psychiatric services. So thank you, and now I'm handing over to Juglu, my colleague, who will talk about addiction.
Thank you, Yemen. Welcome, everyone. This is Duygu Altun from Turkish Probation Services. I'm working as a psychologist for the system for 20 years since the foundation of the system in Turkey. I'm going to take the next 2 minutes to introduce the module on addiction and substance use of our European mental health training curriculum. This module runs for 3 hours and sits at the heart of the curriculum because substance use is one of the most significant and persistent factors driving offending behavior and recidivism across Europe. The goal is straightforward: to give the probation officers the foundational knowledge and practical skills they need to engage effectively with probationers who are struggling with addiction, not as a clinical expert, of course, but as a skilled and informed professional. Next slide, please. By the end of this module, participants will have developed 5 key competencies. First, a solid understanding of what addiction actually is, going beyond the moral model to look at the psychological, physiological, and social dimensions. Second, the ability to recognize different substances and how they affect a person's behavior, thinking, and health. Third, practical skills for applying evidence-based approaches in their daily work with probationers. Fourth, a clear picture of when and how to make referrals to specialist addiction services. And fifth, knowledge of harm reduction and relapse prevention, because abstinence isn't always the first or only goal. These outcomes are specifically designed around the realities of probation work, not clinical practice. And as learning outcomes, the model is structured around 6 interconnected content areas. We start with theories of addiction, because how an officer understands addiction shapes how they respond to it. And we then move into specific substances and their effects, including polysubstance use and dual diagnosis, which is increasingly common in probation caseloads. A dedicated section explores the addiction crime cycle, helping officers understand the patterns behind reoffending. Then we get practical engagement skills, build on trauma-informed practices, including how to work with denial and ambivalence without damaging the professional relationship. And as you see on the slide, the final 2 areas cover the treatment and harm reduction options, from medication-assisted treatment to peer support, and referral pathways, including crisis management and multi-agency cooperation. I'm very much looking forward to your questions and to hearing perspectives from across your jurisdictions. Thank you for listening, and I'm now pleased to hand over to Maya, our expert from Poland, who will cover other disorders.
Thank you so much, Dulkiu. Good morning, everyone. My name is Maja Zawadzka from University of Justice. I am academic. In our university, we train future probation officers. Also, I'm practitioner, psychologist, and psychotherapist. My task was to prepare the module called Other Disorders, because of there is a rise of the diagnosis of mental health conditions in society and amongst probationers. Those who have experienced trauma and adversity are more likely to be diagnosed with mental health disorders, substance use problems, and experience crisis. Trauma and mental health issues often co-occur. Unaddressed mental health issues can negatively impact on quality of life and can also be a risk enhancing. It can be really challenging and demanding for probation officers to work with probationers with such complex needs. That's why we would like to address and to create this part of a model. Please, the next slide. What is also important, it is the risk, because the risk, job risk could really increase the mental health issues. That's why the fundamental knowledge, practical techniques, clear guidelines are crucial here to help probation officers build their capacity to work effectively with individuals experience mental conditions such as depression, anxiety, neurodivergence, intellectual disabilities, and other problems in daily work. And of course, we address also the issue of well-being and the resilience in the profession role. The next slide, please. About the outcomes. Outcomes are mostly designed specifically around readiness of probation officers with their daily test. Slides refers to the key areas of the model. They are divided into two sections. First, affective depression and anxiety disorder. As you see, and with specific teams included. And the last one is about the mostly neurodivergence content and intellectual disabilities. Thank you so much for your attention, and I will welcome the other colleague with presentation.
Hello everyone, my name is Angel Topkerov and I work in the Psychological Service of Bulgarian General Directorate Execution of Sentences. I will briefly introduce the module Engaging with Clients in a Crisis. This module, together with staff self-care, was developed with the valuable support of Sara Arata from the Italian Probation Service. The reason for this module is very practical. Probation officers are often among the first professionals to notice when a client is in a crisis. For example, when there is a severe distress, a suicidal ideation, self-harm, aggression or psychotic breakdown. So the main aim of this 3-hour module is to help officers recognize warning signs, de-escalate tense situations and take appropriate actions. At the same time, it also focuses to officers on safety and emotional well-being in high-stress situations. On the second slide, the focus is on the learning outcomes and main content areas. Participants in the future trainings should be able to recognize crisis situations and respond in a calm, humane, and professionally safe way. The module combines practical communication skills, empathy, professional boundaries, verbal and non-verbal de-escalation, and examples of what to say in critical situations and critical moments, with knowledge about suicide risk, self-harm, aggression, psychotic breakdowns, warning signs, and crisis triggers. It also covers safety planning, crisis management, ethical and legal boundaries, referral pathways, and collaboration with mental health and emergency services. Finally, the module includes a reflection on officers' own emotional responses and post-incident self-care, because crisis work affects both the client and the professional. In short, this module aims to support probation officers in responding to crisis situations with confidence, empathy, and professional safety. Ryan?
Hi, folks. The next module I'm going to look at again. It complements the previous module that Angel talked you through, and it's a general practical module on probation officer engagement with service users who present with mental health issues. And again, the purpose of this module is to improve probation officers' confidence in working with people who present with mental health issues, and to remind or to refresh probation officers that they already have a lot of the key social worker skills that they need to work with service users who present with mental health issues. And also, as mentioned in some previous modules, to develop local referral pathways into local mental health services. Again, I suppose the reason why we stress local is because every jurisdiction is different. Every jurisdiction has, is unique. So it's important that this is developed locally rather than us trying to impose a structure, a pan-European structure on referral pathways. Okay, we'll go on to the next slide. Okay, so the learning outcomes for this module is to recognise the importance of establishing an effective working alliance between the probation officer and their service user. Again, increase the confidence of probation officers, again, in working with service users. To stress the importance of taking a person-centred approach in this work, and for them to develop a greater understanding of their own local mental health ecosystem. So again, that would be, we'll say, specialist services such as dealing with psychosis, other mental health professionals like counsellors or psychologists, and identifying kind of specialist addiction services and any kind of mental health community and voluntary support that's in their jurisdiction. Okay, we'll move on to the key content areas then. So the key content areas, again, it's looking at kind of developing the therapeutic alliance, setting boundaries, increasing service user insight, motivation and compliance with their mental health treatment. Again, looking at motivation, interviewing and solution-focused work. And again, stressing the importance of active listening, empathetic reflection, and working with clients at their own pace. And also there's scope here to kind of explore any potential ethical issues or dilemmas that may arise from working with people with mental health issues. Okay, so that's that module. And I'm going to hand you over to Gorgana Manilova, who's going to look at the module on gender and mental health.
Thank you very much, Owen. Hello, everyone. Glad to see you here at the presentation of the culmination of our work, which is very dear to us. My name is Gorgana Manilova, and I'm an independent consultant from Bulgaria who used to work in prison and probation services and now works in international mental health. I worked on the module of gender and mental health, and on the question of why this module, the reason for its inclusion is that we observe persistent differences in mental health conditions according to gender around the world and across Europe. Those are current and ongoing. Men and women experience cultural and social constraints and pressure on emotional expression and identity that are specific to their gender, and that increases the risk to their well-being. For example, women are considered to be at a higher risk than men for certain mental health conditions such as depression and anxiety, going to double the rate at which men experience these conditions. They're also affected more often by intimate partner violence and gender-based violence, which increases the risk of mental health conditions and exacerbates existing symptoms. Ideas of masculinity affect men's behavior and emotional expression, and we see the results sometimes within the justice system. Non-binary individuals whose legal recognition varies across Europe, but whose existence is a fact in every culture and society, are at a high risk of poor mental health and interpersonal violence, especially suicide. As a mental health outcome. And in part, this happens because of the discrimination, stigma, and crimes committed against them for the sake of, for the fact of their identity. The influence of gender-specific experiences is often not recognized within the justice system, but in the probation setting, it is important to be aware of the different ways in which gender affects mental health and creates the landscape for mental health conditions and poor mental health. And then we see the learning outcomes for the module. By the end of the module on gender and mental health, the participants will be aware of what is a gender-sensitive perspective and how gender affects everyday experience and mental health conditions. The recommended methods for conducting the training on this module are focused on reflection, to reflect also the different conditions under which gender unfolds in every culture and society. And also how people can be supported in probation. And by the end of the module, they will be able to review the gender-specific aspects of daily life of clients in probation, which may impact their mental health, and to maintain a portfolio of gender-specific interventions, resources, services, and referral points to which they can direct clients. The content areas, as mentioned, are around cultural expectations, pressures, constraints around gender, which affect mental health, and those will vary across Europe in the different probation systems. Gender-specific risks and rates of mental health conditions and suicide according to gender, mental health factors in gender and sexual orientation minorities, and probation work and interventions that are informed from a gender-sensitive perspective. Now passing back to Angel, who will talk to us about the self-care module. Thank you.
Thank you very much. Let me now briefly introduce the module Staff Self-Care. The main idea behind this module is that mental well-being is not only a personal issue in probation work, it is also a professional necessity. Probation officers often work under pressure and are exposed to difficult human situations. Over time, this can lead to chronic stress, emotional fatigue, or burnout, sometimes even before the person fully realizes what is actually happening. And of course, this does not only affect the officer's own quality of life, it also affects the influence the way they communicate with their clients, assess risk, and make professional decisions. So the aim of this 3-hour module is not just to provide theoretical knowledge, it is also to encourage reflection and to offer practical strategies that can help probation officers to protect on their own well-being and resilience. On the next slide, the focus is the learning outcomes and the main content areas of the module. The participants will look at the mental well-being means, what mental well-being means, and in the context of probation work and why it matters. They will also learn to recognize common stresses in probation practice, including emotional burden of working with people who have any kind of mental health difficulties and issues. The module pays special attention to early signs of stress, burnout, and compassion fatigue. A very practical part of this module is dedicated to self-care and coping strategies. These are simple and realistic ways to manage stress, maintain resilience, and prevent burnout in a very high-pressure job. The module also highlights the importance of peer support, supervision, organizational resources, and seeking help when it's needed. Another important topic in this is work-life balance, including setting boundaries and managing workload. Finally, the module emphasizes that the supporting well-being of probation officers also benefits probationers. When professionals are emotionally stable, supported, resilient, they're better able to respond in a consistent, humane, and effective way. Thank you very much.
Hello, everyone. Hello again. Well, first of all, I would like to thank you all. I would like to thank all the experts of the group for this excellent and accurate piece of work. Thank you very much. And I also would like to say that we were lucky to work with the external consultant, and the external consultant were volunteers and work as a volunteers together with the experts from the CEP group. So thank you very much. Now I would like to bring the focus on the call that CEP is launching. Building on this major achievement, CEP, or we are taking an important step forward by moving from policy development to operational and practice implementation. CEP, we are actually officially launching a European call for expressions of interest from CEP member jurisdictions to pilot the national implementation of the European curriculum. The pilot aims to test the curriculum in a real setting, in a real probation service, generate implementation evidence, and support future European rollout of this framework. Through this initiative, one CEP selected member jurisdiction will receive financial support, a strategical and technical guidance from CEP, support for implementation and evaluation, and of course, opportunities for dissemination of the results across CEP networks. All in all, to improve probation practice in this very important topic. I also would like to mention, because being aware of the time, I really would like to have some time for Q&A, although as my colleague said, although as Mirka said, if we do not have enough time to answer all the questions, we will answer the questions in written after the webinar. So no worries, because we will take care of all the questions. So what I was saying is that, being aware of the time, I just want to mention that this call, of course, is for CEP members, and that you can access to all the information through the members page. You go to the CEP web page, then members page, and then under the news item, there you will see all the links with all the information regarding this important call. So thank you, everyone.
And thank you, everyone, for sharing your questions with us. And of course, I can see the comments in the chat. We really much appreciate it. To kick off with the question, a colleague from Albania is asking, how does mental health training influence the day-to-day decision-making of probation officers in supervision and case management?
Thank you, Mirka. Maybe I can pick up on that one because I think it's a great question at this moment. And this is the question that we want to answer with this pilot. So one of the interests that the group has in making this pilot that Anna just presented is exactly to understand how it can help and change the practices of probation officers in a specific probation service. So the pilot will include an evaluation. And so this question is very good, and we will try to answer it after the pilot with the specific example of the jurisdiction that will run the pilot.
Thank you, Christina. Answered everything. Thank you so much.
Then a couple of more questions, and that Christina agreed to answer a bit broadly because we would then cover too many, are related to how does the new European training curriculum for probation officers support the practical distinction between mood disorders and personality disorders in offender assessment? How is mental health training integrated into probation practice when preparing pre-sentence report and providing professional advice to the courts? Then the question about how different probation service models across Europe incorporate mental health knowledge when formulating risk assessment and sentences recommendation. And the last one, to what extent does the curriculum aim to harmonize probation officers' approaches to mental health assessment across European jurisdictions? Since we had the chance to see the question, Christina kindly agreed to cover the answer in one moment. So Christina, the floor is yours.
Yes, so very briefly, I think common to all these questions is maybe making a statement about the purpose of the curriculum. So with this curriculum, we tried to answer what should a probation officer working in any probation service in Europe should know about each one of these topics regarding mental health. So it's like to create a standard of knowledge that any probation officer should have to provide a better service to the service users. So the way that it's then used for the purpose of assessment, of case management, this will always be decided by each service and its jurisdiction. This would not be possible to standardize. So when is the training happening? If it's happening in all topics or just some of the topics, this flexibility is something that we discussed in group that should be preserved. It's the only way to make it applicable in several countries and jurisdictions in Europe. So please think about this as a way to provide an outline of the knowledge base that the probation officer should have, and then the practical use will be up to its jurisdiction and the procedures of its jurisdiction.
Gergana, you want to follow
Yes,
up?
thank you. If I may add, from my work in international mental health, I have this cross-country perspective, which tells me that the rates of mental health conditions vary across countries and cultures very much. And I saw that someone in the chat mentioned gambling and gaming addiction, and I can see how this would vary between countries based on the legislation governing, for example, the gambling infrastructure. And so this is why it is important for jurisdictions to have the opportunity to customize their approach by selecting the modules that have the highest priority for them, or each probation service we know faces different sort of clients with different priorities and highest incidence. So it is important for them to have this opportunity to select, which type of clients they see the most, which problems are of the highest priority. Maybe they don't have the resources to do a training on all the modules, so they pick and choose. It would be best if they made this selection by consulting with the probation staff extensively to determine the priorities, and also consulting the epidemiological studies of mental health conditions in that country.
Thank you, Gergana. Does anyone else from the group wants to react on that before we move on? Okay, Jana? No. Then the next question, which I can see in the chat that there is already some answer on that, but maybe we can also pick it. Is there any direction on particular sentence for the modules? And linked to this, is there any guidance on at what point in a probation officer career a particular module should be taught, for example, at introduction or later?
I'll come in here and I'll answer that question. Again, I suppose ideally every jurisdiction would run the curriculum in full. At a practical level, obviously, at induction stage would be the best time for a probation officer to get this training. And again, in terms of established probation officers, again, I suppose the gold standard is that everybody would get the opportunity to get training in the mental health curriculum. So it isn't a case of this isn't a curriculum to develop mental health specialists per se. What it is to create that foundational baseline of competence and confidence for everyday probation officers working with an everyday caseload that come across a significant amount of people presenting with mental health issues.
Thank you for taking this question. I guess it also answered the rest of the question. There is also the question, will the pilot involve all modules? Yes, it will involve all modules, if I'm not mistaken. We reached the end of the question. Is there any other question that you would like to ask, or comment that you would like to share with us before we close this session? Okay, we have a message. We have a message from a colleague from Slovenia. Do you also consider it relevant for the curriculum for probation officers to know the concept and processes of deinstitutionalization related to mental health?
Maybe I jump in if I understood the question, and I think again this takes us always to the same conclusion. I know that in several countries there is a movement of this institutionalization. This is also happening in Portugal. I would say that it depends on how mental health works in your country. Of course, for probation officers, it's very important to understand what is the policy regarding mental health. So in Portugal now, the policy is to disinstitutionalize. And what does this mean in terms of the answers that we have for the people with with the mental health problems, even in the general population? So I think, yes, it is relevant because it's part of the network of possible responses in the community for these clients.
Thank you, Christina, for taking this last question of the today's session, and I'm handing over to my colleagues.
Well, thank you, Mirka, for taking us through questions and answers. And I really want to thank all our experts in our expert group for providing information about the curriculum, about giving us more ideas what's behind and how do they create the curriculum. And also thank you so much for answering the question. I know that sometimes it might seem that maybe some answers are a little bit like general or something, but this is basically when we have one international for everyone curriculum, this needs to be, like Ian just highlighted, this is like the basics. This is the starter pack. And what you saw here is just the topics that are very important for every probation officer working with the clients that need to be addressed. Because in accordance with the European probation rules and with the standards, that majority of the probation services have initial training for new people when they are becoming probation officers. Although some people are coming from very similar work path or somewhere, being a probation officer is very different. And for many people, mental health is not something they tackle during their initial education or maybe in their previous work. And especially not in the way how we need to think about it when we work with the people who are in community, but who are here with the probation officer. Sometimes it's not going to be obvious from the case that there is a mental health issue, but this is why we need to raise awareness along all our colleagues, professionals, to know about this. This is something that we highlighted a few times because this is the basic. This is the starter pack, let's call it like that. And then in accordance with every jurisdiction need, this can be upgraded, for those who need more. For some countries, this will be gambling. For some, this will be alcohol misuse. For some, this will be the different issues between different diagnoses and the types. But we need to be aware that the people working in the probation service are not medical personnel. They can't go in very details, but they need to know different categories of the issues that we can run into. And one also important thing that I want to highlight at the moment, it's also, you saw that majority of the curriculum parts are devoted to the offenders who have mental health issues, but one is also on the staff. Never forget the staff and the issues that are connected with the overburn and with everything that happens when we work with the people in need. So it's also important to talk, when we talk about mental health, not to forget the staff, because the core of every probation service is our probation officer. Without probation officer, there's nothing, there's just, the letters on the paper, and that's not what we want. So we do hope that you will get sparkle of idea with this curriculum. We hope that it will be the guidance for the jurisdictions that do not have anything in their initial or followed trainings for the staff. For those who already have something, we are absolutely sure that there is also something new that you can find in our curriculum. Maybe if you developed your curriculums many years ago, maybe you didn't take into consideration gender that is also presented here. So there are many, many different ways how we believe that jurisdictions can have a benefit of this curriculum. So please read it carefully and just be open-minded that this is not written in the stone. So this is something that is really live, that is flexible, and needs to be adapted to everyone's need. This is what is important. In the CEP, we always highlight in the international cooperation, it's all about the values and the ideas, not about the copy-paste. We always need to tailor the things in accordance with our needs. We are very similar, but we are not the same. So it's going to be very different. In the countries where we have a big probation offices, it's going to be easier to have a specialist for mental health. But in the countries with a lot of small offices where we have only maybe 2 probation officers, there is no possibility for somebody to be expert on something. So it's for the management to provide the basic knowledge to everyone who works in the system. Only like this, only with this approach, we can really make a difference. I do hope that everybody is going home with some new ideas. Please, one homework: if you had heard something valuable for your service during this webinar, please just next time you talk with your colleagues who didn't participate in the webinar, tell them few ideas over the coffee, over the staff meeting, somewhere in the elevator, on the stairs. Just share some idea. This is already one step forward. I want to thank all the participants for being with us. I want to thank our expert group and our colleague Ergana who joined the group for this task. I want to really thank my colleagues Anna and Mirka, and I hope to see you in the future activities of the CEP. Have a lovely afternoon.